In today's session, we will learn CPT cardioversion coding. Basically, cardioversion is very simple. In today's session, first we will learn purpose of cardioversion as well as meaning of cardioversion. And also we will learn CPT code related to cardioversion. And also we will learn how to code different types of cardioversions. If you are planning to write CPT certification exam, or if you want to learn cardiovascular coding, please watch this video until the end. If you like this session, please click on like button. First, we need to understand what is cardioversion. So, cardioversion is a medical procedure to restore normal heart rhythm from an abnormal rhythm. Okay, so what are the common abnormal rhythms? Atrial fibrillation, atrial flutter, as well as supraventricular tachycardia. In cardioversion, we have two types of cardioversion technique. One is electrical cardioversion and second one is chemical or pharmacologic cardioversion. Basically, the purpose of cardioversion is to regularize the rhythm. Again, we have two types of cardioversions, external cardioversion as well as internal cardioversion. So basically, external cardioversion is very simple technique. Here, patient will use electrodes and he will place those electrodes on the patient's heart in order to deliver electric shocks. The other name for this external cardioversion is direct current cardioversion. So in the operative report, if you see external cardioversion or direct current cardioversion, we can use the same code. Next, we have internal cardioversion. So basically, the purpose of cardioversion is same. So basically, in internal cardioversion, patient will insert electrode through the vein into the groin and into the heart. So that is the internal cardioversion. So we don't need to worry. Just basically we don't have any separate codes for this external and internal cardioversion. But we need to understand the technology related to cardioversion. So now we need to understand why patient will perform this cardioversion. So most of the time patient will perform this cardioversion for arrhythmia. So rhythm means irregular. So arrhythmia means irregular heartbeat or abnormal heartbeat. So in order to stabilize this abnormal heartbeat, patient will perform the cardioversion. In CPT, we have two codes related to this cardioversion. One is 92960 and another one is 92961. So what is 92960? Cardioversion, elective, electrical conversion of arrhythmia, external, defibrillation and synchronized. So the name itself indicates this is elective procedure. Okay, so this is not emergent procedure, this is elective procedure. In this procedure, patient will use electrical shocks in order to convert patient's abnormal rhythm to normal. In 92960, patient will also use defibrillation using the defibrillator. So most of the time you will see this 92960 in the hospital or in the emergency department. Next one is 92961. So cardioversion, elective electrical conversion of arrhythmia internal. So atrial or ventricle. We have seen correct internal cardioversion. So this is the internal cardioversion where patient will use veins in order to send electrodes. So here patient will perform this internal cardioversion internally. So most of the time you will see this internal cardioversion during EP study. So what is EP study? Electrophysiologic study or device procedure like catheter based. Next one is we have pharmacologic cardioversion or chemical cardioversion. So basically based on CPT we don't have any CPT code for pharmacologic or chemical cardioversion. Whenever in the documentation if we see if the patient performs pharmacologic cardioversion, we need to use the infusion codes. So in the operative report, if we see pharmacologic cardioversion, we need to use infusion code starts with 96365. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery coding training, IPDRG training, SCC training and CCA certification training, please send WhatsApp message to 707-526-3939. Next, we will see few questions related to cardioversion. So, can I bill for elective external electric cardioversion in the emergency department? Answer, yes. As we have learned previously, we can use external elective cardioversion in the emergency department. Here we need to use 92960. And also try to remember, defibrillation is different, cardioversion is different. We can't use 92960 for defibrillation. For defibrillation, we have separate set of codes. We need to use 92960 only for electrocardioversion. And most of the time, we don't have any code for defibrillation. So basically, this defibrillation is included in the CPR. So cardiopulmonary resuscitation. For that, 92950. Next question. If an ECG is performed before and after the cardioversion procedure, represented by code 92960, may the ECG reported separately. So basically here physician is performing the cardioversion. So before performing the cardioversion, if the patient performs ECG before and after the cardioversion, can we code ECG separately or not? So basically what they are telling based on CPT assistant. So ECG before and after cardioversion is included in cardioversion. You don't need to code it separately. So sometimes based on patient's condition, patient may perform ECG after cardioversion. So that time we need to check for medical necessity. What is the reason for that ECG? So like after the cardioversion also, if the patient is having arrhythmia, patient may perform this cardioversion. And also if a physician wants to analyze more, he may perform ECG. So that time we will use 59 modifier along with ECG, and also we need to provide separate or distinct medical necessity using the ICD-10 CM code. So I hope this session will be very useful for you. As we have discussed, if anyone looking for medical coding jobs in India, USA and UAE, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for medical coding jobs, and also if anyone looking for surgery training, IPDRG training, SCC training, CCS certification training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button and learn yourself, succeed yourself.